Welcome, medical students, to today's lecture on endocrinology. In this comprehensive script, we will delve into the intricate details of hormonal regulation and its impact on various aspects of metabolism. Our discussion will cover a wide range of topics, including hormone regulation of glucose metabolism, lipid metabolism, energy balance, appetite and satiety, bone metabolism, reproductive metabolism, and many others. Before we begin exploring the specific areas of endocrinology, let's take a moment to understand the fundamental role of hormones in our body's metabolic processes. Hormones serve as chemical messengers that facilitate communication between different tissues and organs, ensuring the proper functioning of our metabolism. They regulate crucial processes such as glucose utilization, lipid breakdown, energy distribution, appetite control, and more. Glucose metabolism plays a vital role in maintaining energy homeostasis in our body. Hormones such as insulin, glucagon, and cortisol play key roles in regulating glucose levels. Insulin, secreted by the pancreas, promotes glucose uptake from circulation into cells, enhancing its utilization for energy production. Glucagon, also produced by the pancreas, stimulates the breakdown of glycogen into glucose, raising blood sugar levels. Cortisol, a steroid hormone released by the adrenal glands, is involved in the process of gluconeogenesis, which increases glucose production in the liver. Lipid metabolism encompasses the processes of lipolysis and lipogenesis, which involve the breakdown and synthesis of fats, respectively. Hormones such as insulin, glucagon, and adiponectin significantly influence lipid metabolism. Insulin promotes lipid storage by stimulating the uptake of fatty acids and their conversion into triglycerides. On the other hand, glucagon and adiponectin promote lipolysis, leading to the breakdown of stored fats for energy production. Maintaining proper energy balance is essential for overall metabolic health. Several hormones, including leptin, ghrelin, and neuropeptide Y, NPY, play crucial roles in regulating energy balance. Leptin, produced by fat cells, signals the brain to decrease appetite and increase energy expenditure. Ghrelin, secreted by the stomach, stimulates hunger, while NPY, released by the hypothalamus, promotes food intake and decreases energy expenditure, leading to weight gain. The regulation of appetite and satiety involves a sophisticated mechanism involving multiple hormones. Leptin, a hormone produced by adipose tissue, plays a crucial role in suppressing appetite. On the other hand, ghrelin, predominantly secreted by the stomach, stimulates hunger and enhances appetite. Insulin, a hormone released by the pancreas, along with peptide Y, PYY, secreted by the gastrointestinal tract, signal the feeling of fullness and satiety, subsequently reducing food intake. This delicate hormonal balance plays a significant role in regulating our appetite and ensuring that our body's metabolic needs are met. When hormone levels become disrupted, it can have significant implications on metabolism and lead to various metabolic disorders, such as metabolic syndrome. This condition encompasses a range of health issues including type 2 diabetes, obesity, and dyslipidemia. Hormonal abnormalities, specifically affecting insulin, leptin, and adiponectin levels, have been identified as key contributors to the development and progression of metabolic syndrome. Understanding the intricate relationship between hormones and metabolism is crucial for diagnosing and managing these disorders effectively. The thyroid gland produces hormones, thyroxine, T4, and triiodothyronine, T3, which play key roles in regulating metabolism. Thyroid-stimulating hormone, TSH, from the pituitary gland controls thyroid hormone synthesis and release. T4 is converted into the more active T3 form, which influences metabolic rate, body temperature, and energy utilization. Steroid hormones, including cortisol, estrogen, and testosterone, are derived from cholesterol. They play significant roles in various aspects of metabolism, including glucose regulation, bone metabolism, and sexual development. The production and regulation of steroid hormones involve complex processes within the adrenal glands, gonads, and other tissues. Bone metabolism is regulated by several hormones, including parathyroid hormone, PTH, calcitonin, estrogen, and testosterone. PTH promotes calcium release from bone tissue, while calcitonin balances calcium levels by enhancing its deposition in bones. Estrogen and testosterone play crucial roles in bone formation and maintenance. Endocrine disruptors are substances that interfere with hormone function in the body. These disruptors, such as bisphenol A, BPA, and phthalates, can impact metabolic processes by altering hormone levels, leading to potential health issues such as obesity, insulin resistance, and hormonal imbalances. The brain, particularly the hypothalamus, plays a vital role in regulating metabolic processes through the integration of neural and hormonal signals. Neuropeptides and neurotransmitters, such as neuropeptide Y, NPY, pro-opiomelanocortin, POMC, and serotonin, are involved in appetite control, energy expenditure, and metabolic rate regulation. In the field of endocrinology, it is crucial to understand the intricate relationship between hormones and metabolism, specifically in the realm of reproduction. Hormonal regulation plays a pivotal role in maintaining the delicate balance required for reproductive metabolism. Key hormones involved include estrogen, progesterone, and testosterone, which are responsible for regulating crucial processes like the menstrual cycle, fertility, and sexual development. The meticulous orchestration of these hormones ensures proper functioning of reproductive metabolism. However, any disruptions or imbalances in their levels can lead to metabolic disturbances, such as polycystic ovary syndrome, PCOS. PCOS, characterized by hormonal abnormalities, can significantly impact a person's reproductive health and overall metabolic well-being. Understanding the comprehensive dynamics between hormones and reproductive metabolism is essential in the field of endocrinology. It enables medical professionals to diagnose, manage, and treat various conditions associated with hormonal dysregulation effectively. By staying abreast of the latest research, medical students can further advance their knowledge and contribute to the improvement of patient care in this specialized field. Physical activity and exercise have profound effects on metabolism, influencing hormonal responses and adaptations. Hormones such as growth hormone, cortisol, and insulin like growth factor 1, IGF-1, play significant roles in regulating muscle metabolism, energy utilization, and tissue repair during exercise. In conclusion, hormonal regulation is a complex and intricate system that influences various aspects of metabolism, including glucose and lipid metabolism, energy balance, appetite control, bone metabolism, and reproductive metabolism. Understanding these intricate processes and hormonal interactions is crucial for diagnosing and managing metabolic disorders. By continually advancing our knowledge in the field of endocrinology, we can improve treatments and interventions to help patients achieve optimal metabolic health.